Welcome, welcome everyone to tonight's Acts 2 workshop, Evolving Roles of First Responders in Dementia Care, Crisis Management to Community-Based Prevention. I'm Dr. Rob Glukoff, servant leader of the Acts 2 project and professor, Florida State University College of Medicine. In case you are unfamiliar with the term Acts 2, it stands for African American Alzheimer's Caregiver Training and Support Project 2. Folks, I am very excited about the prospects of tonight's workshop. The primary goals of this workshop are to provide practical information about how to manage dementia-related crisis situations and what you can do to prevent them. Dementia care specialist Nicolette Castagna will demonstrate an easy-to-use approach known as REACH for effective problem solving in urgent care situations. Officer TiBria Howard will share her personal experiences in negotiating crisis situations, such as locating a loved one with dementia who's wandered from their home. Next, Fire Chief Charles Brunner will highlight important developments in community-based prevention of dementia-related emergencies. He will also share information about the costs of emergency services and how to manage them. Last, Acts 2 coordinator Tamika Norton-Brown will provide information about faith-based skills training and support for dementia caregivers. You folks, audience participants, the wonderful participants that you are strongly encouraged to ask questions and provide input throughout the course of the workshop. Before I introduce this evening's presenters, I wanted to recognize our partners who've contributed both resources and guidance in the development of the Acts 2 Dementia Caregiver Workshop Series. Acts 2's primary collaborators are the Florida State Primitive Baptist Convention, the Florida General Baptist Convention, the Florida Progressive Missionary and Educational Baptist Convention, African Methodist Episcopal Church, 11th Episcopal District, and Florida State University College of Medicine REACH Project. Turning now to tonight's presenters, we have four inspiring speakers. Our first presenter, Nicolette Castagna, is a licensed mental health counselor and a certified dementia practitioner. Nicolette obtained 2 master's degrees, one in clinical mental health counseling from Wake Forest University and a second in public health from Florida State University. She currently serves on the leadership team of the Geriatrics Workforce Enhancement Program at FSU's College of Medicine. Nicolette also works as a counselor at the Tallahassee Senior Center, promoting the emotional and physical well-being of older adults in the community, particularly family caregivers. In her limited free time, Nicolette loves live music, cooking, and spending time in nature. Our second presenter, Officer TiBria Howard, serves as a member of the Special Response Team and the Special Victims Unit of the Tallahassee Police Department. She received her bachelor's degree in criminal justice from Florida A&M University. TiBria has had special training in crisis intervention and is a former field training officer. Note that Officer Howard's outstanding work in dementia emergency management was featured in the nationally acclaimed REACH program documentary, Dementia Resources for First Responders and Family Care, portions of which you'll see, folks, this evening. TiBria likes working out. She also very much enjoys spending time with her dear family and anything related to the water. Our third presenter, Charles Brunner, is Fire Chief for Jackson County Fire Rescue in Marianna, Florida. He was born and raised in Jackson County, Florida. Charles began his career as a 911 dispatcher while enrolled in the EMT school and firefighter academy at Chipola College. He subsequently worked at Bay County, Florida Emergency Services and served as supervisor of their EMS division. In January 2019, Charles returned home to Marianna to take a job as fire chief of Jackson County Fire Rescue. He has been married 11 years to his dear wife, Marsana, and they both have 2 wonderful children. Charles and his family enjoy fishing, hunting, and they are both, all of them are active members of their church. Last, Tamika Norton-Brown is coordinator of the Acts 2 project. She has worked in the area of survey development and evaluation for the past 23 years. She served also as a caregiver for her dear aunt and uncle with dementia and has a passion for helping others. Tamika has been a great source of encouragement and support for literally hundreds of family caregivers of older adults with dementia across Florida. Tamika is also a strong leader by example in her church community. Folks, during the course of this workshop, I encourage you to share questions after each, to be answered after each presentation using the text message function of Facebook Live. We also will have a 15 to 20 minute question answer period following the last presentation. And now we have Nicolette Castagna. Welcome, Nicolette. We are so privileged to have you aboard this evening. I'm very much looking forward to your presentation.
Thank you for having me. It's exciting to be here and to be sharing this important and sometimes, hard to learn about and hard to face stuff. So I'm excited to share this program that we've developed through a federal grant that we have. Acts 2 is one of our big partners at the College of Medicine, where we've designed training materials to help people know how to effectively respond in situations that involve a person living with dementia, stressful situations, things that rise to a crisis. So go ahead and move on to the next slide. Thank you. So there's over 6 million people in the United States living with dementia, many whom are cared for at home by family members or friends. And I'm going to talk about the symptoms of the disease briefly in just a few moments. But because of the condition and some of the challenging symptoms that arise, stressful situations can occur. So you all are in the right place to be learning, to be understanding what you can do to take care of yourself, take care of your loved ones, and understand what's out there that can help. Go ahead, next slide. Thank you. So we want to be prepared in the event of an emergency to know what things can be effective, how to minimize harms that ourselves are facing and persons with dementia are facing. So these training materials were created for family care partners and also for professionals in the field, for first responders that are those that are arriving after a 911 call, so that we're all equipped with better understanding of how dementia affects individuals and how to best respond and interact with a person with dementia to help them feel safe in a challenging situation. Next slide. So to briefly touch on some of the symptoms of dementia, it's important to recognize how this condition affects someone's ability to interact with other people, and how it affects their ability to interact with their surroundings, with the environment that they're in. Changes in the brain that arise from different types of dementia affect people's memories. It can affect people's language and communication skills. It affects people's judgment to know this is a dangerous situation, to kind of understand right from wrong, and to be able to perceive things as others may be able to. It also affects sensory abilities, vision and hearing. So sound and vision might be distorted or amplified. So when you think about all that, you can better understand how a limited ability to understand or to communicate can lead to a crisis situation. We like to explain that behavioral symptoms are of dementia, those different things that come out, agitation or anger or fear, they are someone's inability to communicate their own needs. It's their ability to try to communicate something that's going on with them. There's purpose behind it. So hopefully that helps us all get a better understanding of the condition and just how crisis situations can occur. Next slide, please. So with that being said, we want to equip you all with some strategies and tools to help de-escalate or to calm a stressful situation. And we can do that with our communication and by making little changes to the environment around us. So let's get into those. So verbal communication, outward or spoken, the way that we speak to somebody out loud, is very important in our interaction with persons with dementia. We encourage interactions to be purposeful, to be very concise. You don't want to be too wordy or stack too many sentences on top of one another because that might cause somebody to get confused, to get frustrated. In a stressful situation, if someone is upset, if things are a little chaotic, try to be as positive as possible. I know this can be hard, but our energy, our language is contagious. Try to be positive, reassuring, and helpful. Have empathy. Try to understand what they're experiencing in the moment. And we really encourage people to not argue and not try to correct what someone thinks is their current reality, but to meet them where they are and help to build that trust and connection with them so they can cooperate and we can get a situation to have a better outcome. We also think about nonverbal communication. So the ways that we interact through facial expressions, through hand gestures, that is so much of how we communicate with one another if we realize it or not. So think about your facial expression. When someone gives you a dirty look, it's really obvious and it causes a reaction with you. So try to be as neutral with your facial expressions as possible, as calm as possible when stressful situations occur. Think about the tone of your voice, the volume of your voice, hand gestures that you're using. Try to have open and calm posture and body language. And also think about how close you're standing to somebody. Maybe you need to back off a little bit. Maybe touch is comfortable to them, but it also might be uncomfortable and triggering to them. So think about some of the things that you're doing with your body when you're interacting with that individual. Next slide, please. Thank you. So we can also think about our environment and things around us that might be making things more stressful, more heightened. So we want to minimize distractions, minimize clutter as much as possible. Think about things in the room that might be causing somebody to be more upset, those visual things. Think about all the sounds. Competing sounds can be quite overwhelming. So turn the TV off, turn your phone on vibrate. For first responders, if they can minimize the sounds of their radios going off, those kind of little changes can really help to calm down a situation. Think about the lighting in the room. Is it too bright? Is it too overwhelming? What about mirrors? What about things that someone is maybe they're thinking it's something there, but it's really just a shadow. So consider if it's a shadow that someone is being upset by and try to make those modifications as you can. So think about changes you can make in the environment. All right. So here we have our REACH approach. This kind of summarizes a lot of the things I've gone over the last few minutes into an easy to remember acronym. So we have R. So this is what you use in a stressful situation to try to help de-escalate things, calm things down, and have a better outcome. Think about the risk of persons involved in a situation. the risk of harm to yourself, to others, to the person with dementia, and consider the risk of what's going on. Establish trust with the person with dementia. Try to help them feel calm, feel supported, feel they can trust. This trust and establishing trust is really, it's done through our communication with them. So practice some of those good communication skills. Think about your tone of voice, your body language. And then assess the need of the person with dementia. What's going on with them? What do you need? When a first responder is there, maybe what information could help your family that you could ask them about? What is something the first responders could use that would help them to better interact with your loved one living with dementia? Something, and you'll see that in our video we're going to see in just a moment, but maybe a little clue that they can mention to help the person with dementia feel more trusting and more safe. And then think about the calm environment. What are some of those changes you can make in the moment to try to help somebody feel a little bit more at peace, a little bit less overwhelmed? And lastly, healthy partnerships. That H stands for healthy partnerships. Let's work together. Let's work with community organizations that are there to help, like Acts 2. Let's collaborate with first responders that are there to try to help us be safe and help our loved ones be safe. Let's partner together and work together through healthy partnerships. So there's that reach approach. We'll try to we have some links to our videos and some materials, but this is what we really would love for all of you to remember and try to apply when things get a little hairy. Next slide, please. All right, so we are so excited to share about a 5-minute video with you all. This demonstrates our reach approach in a situation where paramedics had to be called into someone's home. So please take note of some of the things that the caregiver does, the wife does, and some of the things that the paramedics teams do to help calm the situation. We're going to get that video going for you in just a moment.
We're getting sick. What's up?
William, are you okay? Honey, what happened? Are you hurt?
Get out of there! Get out of there! Oh, it hurts. There's a man in there.
It's just me, Helen. I'm here now. Look at me, it's Helen. Honey, I gotta get this. This is 911. I gotta get us help. Hello? Yes, my husband has fallen in the bathroom. I think he's hurt his arm or his wrist. Yeah, my husband has dementia and he thinks there's somebody in the bathroom with us, but it's just him and me. Yes, he thinks there's somebody in the bathroom and it's really upsetting him. Here's a list of his medication and his doctors and his emergency contacts.
Thank you. Thank you. Is this his first time seeing somebody you don't see, that's not actually there?
I believe so.
Is he taking any new medications?
No.
Okay.
Where's Helen?
Hey, I'm right here, honey. I'm right here.
Hey, William. Hey, William. William, my name is Jason. This is Andrew. And we have Brady outside. We're here to help you. Are you hurting anyone?
There's a man over there. Get him out.
William, look at me. You're safe. My name's Jason. That's Andrew. Andrew needs to take your blood pressure, okay? We're here to help you. Do you remember if you hit your head?
No, I don't think so. My arm, it hurts. Don't touch.
It's okay, William. We're here to help you. Can we get you to the stretcher? Can you stand with us?
No. Where's Helen?
I'm here, honey. Let these men help you. Honey, you need to get to the hospital. Let the men help you, okay? I will meet you at the hospital, honey.
Okay, William. We're going to splint your arm before we get you up, okay?
Here, I told William I was going to meet him at the hospital, but would you give him that picture? This is a picture of our old dog, Max, and he really likes that picture. It keeps him calm, and I usually give it to him when I drop him off at our daughter, and he holds it until I get back with him.
Thank you.
Thank you.
Let's get up.
Okay, so I imagine the audience probably has some reactions to that video. Hopefully it was helpful for you to see the reach approach in action. Got some thunder where I am. Hopefully that's not interfering with the audio. Can't do anything about nature. But so some key things that you saw in that the wife did. She quickly responded when she heard her husband fall in the bathroom. She communicated that my husband has dementia. So that is a really big takeaway from these, that we want you all, if an emergency situation occurs, make sure that that you communicate with the dispatch on the other end that your loved one has dementia, so everyone knows going into it what their condition is. We'd love to hear questions. If you all have any, please put them in the chat about what you saw, any comments about what you saw. So please let us know and interact around this video and anything that came up for you as you were watching. So we want people, as you saw, the wife was very calm. There was a lot of use of the word help from the first responders, from the wife. We're here to help you. They were reassuring. They were calm. Something that the wife did as well is she had all of his medications, all his medical conditions in a nice packet ready to be handed to the paramedics team. We have these little materials. They're called File of Lives, and they have an insert. You put them on the fridge. You can put all of your medications on there, your doctor, advanced directives. I encourage you to have something of the sort where everything is in one place. Have those things together in the event of an emergency. It's better to be prepared. And the last thing to highlight that the wife did is she gave the paramedic team that picture of the dog. And you saw how calm it made the gentleman that was about to be taken away to get his arm evaluated to see his old furry friend Max. So what's something that you can give the paramedic team or the law enforcement team to help your loved one calm down a little bit if they're being transported? So these are calmers. These are really useful tools that we want people to be thinking about so that those professionals interacting with someone with dementia can build that trust. So the key actions the care partner took, let's see just real quickly to go through some of the things that the emergency medical team did well on the next slide. So what did the first responders do? They were very intentional in their interactions with William. William, we're here to help you. They told him what they were going to do next before they did it. We're going to take a look at your arm. We're going to take your blood pressure. That can help someone with dementia be included in what's going on with them. So they have that choice. They understand what's happening. They made really good eye contact with him. They got down at his level. They weren't standing over him, which can be very intimidating to people. So get down on their level to make eye contact and to help them feel a little bit more comfortable. They introduced themselves a couple times, and you might need to do that. Even if this is a very close family member, introduce yourself. I'm Sally. I'm here to help you. Be calming and reassuring. They also offered community resources, have those ready to go, and understand the signs and symptoms of dementia. They understood that he was not recognizing himself in the mirror, and he thought it was an intruder. So they moved the mirror out of the way, did not argue with him, didn't argue and say, oh, no, there's no intruder in here. They simply noticed what the trigger was for his fear, and they moved it away. They calmed the environment. So hopefully this was helpful for you all to see such a great response in a challenging situation using the REACH approach. We're going to have another scenario in just a moment, and we're going to hear from Detective Howard, and just appreciate y'all's attention so far, and thank you for being here.
Well, thank you so much, Nicolette Castagna. That was a very informative and provocative presentation. Oh, my Lord. I just have a couple questions for you. Would that be all right?
Sure, I'll do my best.
Okay. Well, I'm sure you will. I know you bring it. What suggestions do you have for care partners or caregivers to interpret effectively the feelings of loved ones during crisis situations?
Maybe it's could just be asking yourself, what would make me feel that way? What would make me do that? So really thinking about, is it fear? How could they be interpreting something? As a care partner, you probably know your loved one very well. So what are some things that might set them off? What's something that could have happened a few moments prior that is upsetting them now? So just think about how overstimulated they might be. That could be causing something to be more heightened and causing more frustration, more fear, whatever that emotion is that they're experiencing.
Well, thanks so much. Just one more quickie question. In the video, we saw that one of the comforting objects that was given to the loved one with dementia was a photo of dear Max, his dog. Are there other types of calmers or comforting objects that you would suggest? And in other words, how would someone know what to give them, give a loved one if they needed to be transported by an ambulance to a hospital or to another location?
Yeah. Well, think about when your person is not exhibiting challenging behaviors. What are they doing? What are they enjoying? And try to replicate that in some way. Is it when they're with their grandchildren? Get a photo of beloved grandchildren for them to take with them. And maybe there's not an object, but it's a person that could be mentioned. Asking about grandchildren, asking about their church that they attend, asking about their favorite scripture verse. Think about things that are positive for them that could be mentioned to build that trust and could help them feel a little more calm and connected in a tough situation.
Well, thank you so much, Nicolette. I look forward to the panel discussion where we can ask you a few more questions. I have at least 5 or 6 myself.
Thank you, Dr. Rob, for engaging and having me on.
Thank
you. It's my pleasure.
And now we have Officer TiBria Howard. Welcome, TiBria.
Thank you, Dr. G. Thank you. Hello, everyone. I am Detective TiBria Howard. I work with the Tallahassee Police Department Special Victims Unit, and today I will be talking to everyone about the approach that law enforcement take when responding to a patient with dementia who has wandered off. Next slide, please. So this video shows a wandering case. It's said about that 6 out of 10 persons living with dementia will wander or get lost at least once over the course of the disease. So it is extremely important for families to be aware of preventing tips that help us when we respond out to locate patients with dementia. If you want to go ahead and start, please.
Hello? Mom? 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 Hello? Yes, my mother Laura is missing. She has dementia. 444 Acre Street. Yes. Yes, she is 60. She's about 5'4", 150 pounds. She has silver short hair. She has black glasses. Please, she has dementia and she doesn't look like it. And she has a medical ID bracelet that says she has dementia and it has my name and phone number. No, she doesn't drive. Okay. Okay, I'll wait here for them. Thank you. Thank you.
Hey, are you Christy?
Yes. come
Hey,
in.
I'm Officer Alfred with Task Police Department. What's going on tonight?
Thank you so much.
When was the last time you saw or spoke to your mom?
I saw her 2 days ago and we spoke last night around 7 p.m. I call her every night to make sure that she takes her medication and that she locks the front door. I call her every morning, every afternoon, and every evening just to check up on her. I live nearby. My wife makes her meals. We come by every Sunday, we have dinner, and we set up her meals for the week. So when she didn't answer her phone, I came over, the door was open, and she wasn't here.
Has anything like this ever happened before?
No,
Do you have your mom linked to any safe return programs?
I don't know what that is.
Do you know what she might be wearing?
No, I have no idea. She does have a medical ID bracelet that says she has dementia and it has my name and my phone number just in case of emergency.
Do you have a recent photograph of your mom?
This is a recent photo taken about 6 months ago.
Okay. Does she always wear those glasses?
Yep, black frame, rhinestones.
Okay. Can you send me that so I can send it out to the officers looking for her?
Of course.
Is there anywhere you think she might go?
No, I have no idea. She takes blood pressure medication and she didn't take it last night or this morning.
Is she diabetic?
No.
All right, I'm going to take this photograph and put it out to the officers and put an alert out for your mother. Let me make sure I got everything correct. Your mother's name is Laura Foster. She's 60 years old, 5'4", 150 pounds. You said she had his medical ID bracelet, which notifies us that she has dementia and it has your phone number. Does she respond best to Mrs. Foster or Laura?
Yes, my cell phone number. My mother responds best to Laura. Thank goodness the doctor recommended that we get one just in case something like this happens. I honestly never thought that she would leave the home.
Okay. I've got some information for you about safe return programs. But first, let's go find your mom.
Police 662 dispatch. I have eyes on who I possibly believe is Laura. We're going to be at the corner of Henderson and Park. Good morning, Laura. I'm Officer Howard with the police department. I know your daughter Christy is looking for you.
You know my daughter, Christy? I'm trying to find her house. I'm looking for her. Can you help me?
Laura, may I see your bracelet, please?
Yeah. I got to get to my daughter's house because she's waiting for me. Can you help me?
Yes, I'm going to call Christy now.
Okay.
I'm calling Christy.
Hello?
Hey, is this Christy?
Is that Christy?
Hey, this is Officer Howard. I have your mother here. She was walking home and got turned around. Are you able to come to the corner of Park and Henderson and come get her?
Yes, I'll be there soon.
Okay, good. I'll wait right here with her.
Oh.
So the video showed some very important key actions that law enforcement take when we do respond to the missing, wandering person with dementia. Here we have a list of key actions for care partners. One, essentially call 911, communicate to the dispatcher that a person missing has dementia, offer solutions to build trust, remain calm and focused when speaking with all first responders, answer questions calmly and to the best of your knowledge, have a recent picture of the person, prepare emergency information handout, have a medical ID bracelet information ready, or enroll them in safe return programs such as our Scent Evidence or our Project Lifesaver. Consider easy home modifications that help prevent wandering. Next slide, please. This slide is focused on the first responders' key actions. Key actions for first responders are be calm, direct, purposeful with the care partner, observe surroundings for risk assessment, medical history, try to establish a timeline, get most updated photos and any personal markings that can identify missing persons, and reach out to any community resources to locate the missing person. With this, so typically what we do with the community resources, we gather more law enforcement officers to check around the area, see if there are anything out of the normal. Once we have more hands on deck, it is easier for us to spread people out and cover more area to look for the wandering person. Next slide, please. So right here, we have some resources for wandering prevention. Different law enforcement agencies partner with these programs to help find missing persons and bringing them home safely. Here in Tallahassee, we do use a few resources. We use Scent Evidence. We use Project Lifesaver. We have Alzheimer's Project. We do with FDLE. We do Silver Alert, Purple Alerts. Another one that we do use that a lot of people don't know about is we have A Child is Missing. So with our Scent, with our Scent Evidence resource, what it is here at the Tallahassee Police Department, we actually have a bloodhound that tracks the scent of any person. One of the things that we do is right here, like we have a Scent Evidence kit right here. So typically what we do is you use one of these nice sterile sheets, and all we do is tell them to wipe the person down. Once you wipe them down, you'll go ahead and you'll put it in here. What you can do, what we do is we write their name on the top. We write the date that we took the scent. And so what we do after we get there, we get on scene, and if you have one of these, what we do is prior to us getting on scene, bring it out. And we give it to our canine handler who lets the bloodhound smell it. Typically what you see is the bloodhound takes off and they start going in the direction of the person. We recently just had a success story where our canine went out to another county and helped assist looking for a missing autistic child. They recovered him miles from the house and he was safe and no harm. But those are one of the success stories that we use. With Project Lifesaver, Project Lifesaver is they provide you with a transmitter or a tracker device that you can either put on your wrist or you can put it on your ankle. And what happens is it emits a frequency signal out to the device that the law enforcement agency use. Here in Tallahassee, Project Lifesaver is done by the Leon County Sheriff's Office. I know in Gadsden County, they also do it, Jefferson County, as well as Wakulla County. We also do the child is missing. So with a child is missing, what happens is you give us all the information of the missing person, and we call the child is missing number. With that, the child is missing is they do an automatic call to all landlines. I know a lot of people don't have landlines, but some still do. They call the landlines and they tell them, hey, be on the lookout for this missing person, and this is what they're wearing. That has worked for us a lot, especially with missing children. We call it, and then sure enough, our dispatch center starts blowing up with calls stating that they saw the child or they saw the person walking this way. Here at Tallahassee, the police department, if you do not have a scent kit, we do have so many. You can always order them from the Scent Evidence website, or you can actually come down to the Tallahassee Police Department, tell them, hey, you're trying to get up with the Special Victims Unit because you want a scent kit, and we give them out free of charge. Anytime if you've never gotten one and we happen to come out to your house to look for the wandering person, what we can do is we can just drop these off after we're done, and it's free of charge. If you need another one, we can give you another one. We have so many of these, and we get them so often. Next slide, please. Here's how you can access the videos. We have a QR code here. And if you have any questions, I am here for you.
Thank you so much, Officer Howard. That was so down to earth, and it was exciting to see you in that video. If I were that lady, I would have been very comforted by your presence.
Thank you. Thank you.
One question for you. Would that be okay? For me?
Sure. Sure.
Okay. What are some of the most important lessons you've learned in working with loved ones with dementia in crisis situations? What percolates up for you? What for lessons learned?
Oh, so many. I would say probably the biggest one is to be gentle. So here at our department, probably I would say a good 50% of our officers are they have been certified for crisis intervention. And with that training, one of the biggest things that we've learned is how to be gentle with anybody, meaning talk to them softly, don't talk to them down. Like the video, if they are sitting down, get down to their level. Or even if they're not sitting down, just, we don't want to come off as we're the police officer. What we do is we come there like, hey, we're helping you. It's okay. We talk to them. We try to build a rapport, try to talk to them about things that they may like, or just different things so they can feel comfort around us. I've realized a lot of patients or loved ones with dementia, when they get around law enforcement, it's so scary for them. For whatever reason that's going through their mind. So I would say it's probably to be gentle.
Thank you so much. And, I think that's so important. And what a great presentation, and what a great example of a servant leader you are in the community. We're blessed to have you here in Leon County.
Thank you.
Why don't we hold back on that question, and we're going to bring it up in the panel at the end. Yeah, and now because we're a little bit short on time, we're going to move on to Fire Chief Charlie Brunner.
Thank you, Dr. G.
It is just a great pleasure to be with you, and thank you so much for participating in this workshop with us, Charlie. And I know you have a great story to tell, so I'm going to turn it over to you.
Thank you so much. Thank you all for joining the panel tonight. I wanted to talk about my role in dementia care from an EMS fire rescue base standpoint. One of the new things that is up and coming for EMS is we are becoming more a community-based role in the communities that we serve. And so one of the newest terms and the newest scope of our work is community-based paramedicine. Typically, our EMS providers, our EMTs, paramedics, would just respond to patients' homes for 911 calls and transport them to the hospital. Now, beginning in 2020 and moving forward, around Florida, there are different types of community paramedicine programs that are kind of built to fit the community in which they serve. This is a new theory and a new scope of work, for our paramedics, and it kind of gets them more focused on prevention and education, and it prevents overuse of 911 and ambulance transport, and it helps out our most vulnerable population, especially bedbound patients, homebound patients, patients with dementia, including caregivers that may not have any option to turn to. Next slide, please. A little bit of background behind community paramedicine. The provision of health care using patient-centered mobile resources in the out-of-hospital environment. MIH, which is Mobile Integrated Healthcare -CP community paramedicine, is provided by a wide array of healthcare entities and practitioners that are administratively or clinically integrated with EMS agencies. While community paramedicine is one or more services provided by EMS agencies and practitioners that are administratively or clinically integrated with other healthcare entities. Community paramedicine came about, you have your hospice, your home health agencies, and then you have your physician offices, practitioner offices, and your hospital system in your community. Really, community paramedicine just came into play to try to bridge that gap. We're trying to bridge the gap between how to reduce injuries and illnesses in home, how to reduce overcrowding at hospitals, how to get patients more connected with their primary care or practitioners in their hometown, how to get patients access to resources and their caregivers access to resources that they may not know that are available to them. And including things like transportation could be a big issue, especially in rural areas or areas that is heavily densely populated. Community paramedicine is paralleled with mobile integrated health because the paramedics are using technology to come out to patients and caregivers' homes, and they're connecting these patients and caregivers with physicians and practitioners to be able to provide medical services without having to leave the comfort in the environment that the dementia patient and the caregiver are in. So they're using this technology to bridge that gap, and it works very well for patients and their families. Next slide, please. The benefits of community paramedicine. What we found is caregivers can call on community paramedicine when there's no other option. Caregivers may run into situations where they feel like that they have nowhere else to turn to but to call 911 and have that patient transported, when all reality, the patient may not need to be in a very loud and busy and robust emergency department. When the EMS agency can come out and provide community-based paramedicine where they can open up the door to many resources. It might be a doctor's appointment that they can need to get set up. The paramedic can help draw labs and blood tubes and take them back to the hospital while keeping the patient in the home. They may be able to schedule appointment, arrange transportation if transportation is not available. They may be able to get on a video chat through their technology, gather vital signs and pertinent information for the practitioner, and all in the comfort of the home of the patient and the caregiver. They may be able to connect them to resources like respite centers. and other types of home health, paramedics may be able to know that there's a need for home health and physical therapy. There may be a gap that maybe not be met there. Another benefit is community paramedicine is in rural areas where there's no respite centers available. In the county that I live in and serve in, we do not have any daytime respite centers. A lot of the caregivers rely on home health aides, home health agencies, other family members, church members. They also have to privately pay sitters to come in and sit with these patients just to give them a break, so that they can take care of family affairs or take care of important errands and even their self-care. Transportation availability. The benefits of community paramedicine is that it comes to you in your community. In rural areas like mine, we have a very limited transportation system. And as you know, that gets booked out way in advance. So when a urgent need comes up, transportation may not be available, public transit, to get these patients to definitive health care. EMS, community paramedicine, can come in and they can actually try to arrange transportation, whether it could be another non-emergency transport service, it could be a faith-based service, it could be a wheelchair van or something of that sort. Unaware of resources, a lot of our dementia caregivers and our patients in our communities in Florida are veterans of the United States military. And with that, they may not be connected to the county's veteran service officers. And so they may not be tapping into benefits that they know that they should be eligible for. And so having a county or city-based paramedic in the community paramedicine may be able to tap into resources to help these dementia patients and their caregivers get benefits, like it might pay for part-time sitting, it might be free access to health care. There's so many different programs and it's always changing, but community-based paramedicines can get the families and the patients in contact with the Veteran Service Office and the county and tap into resources that they may not know that are available. And then difficulty in communicating with physicians. As we all know, this is a big issue that I found with family members is when you take family members or accompany them to physician doctor's appointments, there's just a small lot of time, and especially in a patient that needs a lot of time and a caregiver that has a lot of questions, a patient that might have multiple medical problems, be prescribed multiple medications. You need a lot of time to get the full picture or the full story across to the physician or the practitioner. One of the things is that I found is a lot of that information's lost. The ball may be dropped. And so having a community paramedic come out and assess the situation, and spend more time with the family, they can effectively communicate the needs back to the physician. One of the cases we had recently in our county is we had a patient that was calling 911 in the home up to 6 times a day for 30 days in the month, and it put an extreme strain on our rural EMS system. And we used our community paramedicine to speak with the physician because we shared the same patient. And the physician had no idea, although the patient is regularly followed up with their caregiver in the office, that piece of pertinent information was left out, that there was some unmet need for the patient, and the patient was calling 911 frequently. Until I brought it up to the physician, they had no idea. And so this physician immediately intervened and contacted the family directly and actually performed a home visit. And we were able to get that patient therapy resources and even further home sitting resources with extra caregivers that rotated through. And it drastically reduced unnecessary 911 calls. Bridging the gap, like we talked about, reducing calling 911 for non-emergent complaints. By all means, if you feel like you need to call 911, we are here and your EMS service is here. So please don't take this as do not call 911. If you need it, please call us. Community paramedicine also reduces taking patients out of their home. As we all know, the patients of dementia are very comfortable in their home, especially with their known caregiver that they see pretty often. And so community paramedicine brings the paramedic to the home in a much reduced fashion of speed. So there's not a big push on getting the patient, getting them out the house to the ambulance. It's a very controlled environment. We connect patients with other community-based resources, whether it be the senior center, whether it be veterans resources, and it may be as simple as establishing care with a primary care physician or a specialist. And then we focus on prevention. A lot of EMS services with community-based paramedicine focus on fall prevention. Another good thing Nicolette focused on was the file of life, so having information in the home. We talk about medical alert IDs, bracelets, those types of alert ID, medical IDs. Next slide, please. The cost for EMS and dementia care. Community paramedicine Florida has been funded by Florida Department of Health grant pilot projects. And this is wonderful. It's been in the making the last couple of years. And the cost is not costing our local taxpayers any money. This project's free for them. This adds more career mobility for our paramedics that may be burned out running 911 calls. So it allows them to expand their scope. The community paramedicine program in most communities are free to patients and caregivers as they are taxpayers of the response area. And this community paramedicine is exploring our alternative transport destinations for patients. Like we said, dementia patients may not need to go to a very loud and fast-paced emergency department, but there may be something alternative that they need to go to, such as urgent care center or even primary care center. Mobile integrated health with that, Medicare and Medicaid services are working on starting to reimburse EMS agencies for their mobile integrated health. So to help cover the cost, these EMS agencies are recouping some cost and going out to their patients' homes and doing care in the home. So we look for community paramedicine to expand drastically, and not only in Florida, but around the United States, as we just are another puzzle piece and help focus on community prevention, caregiver education, and just being more involved in the community. Next slide. If you have any more information, please contact your local EMS or fire rescue department in your community. And if they don't have a program or they're trying to start up their own program, they certainly can give you more information.
Well, that was very exciting, Fire Chief Brunner, to hear about the development and the evolution of emergency medical services. And my sense is, correct me if I'm wrong, is that you're a leader in this area. Am I correct?
That's correct, sir.
Yeah. I thought that was an obvious question. I have one general question for
Yes.
you, Charlie. Can you tell us what led you to begin with to get involved in community-based EMS services, and this what you've described as community paramedicine?
Yes, sir. Being involved in community-based paramedicine, I grew up with a family of physicians and practitioners, and I always saw it when I started EMS that so many family members and patients are falling behind and they're not getting the care that they receive or deserve. And we run on so many patients being a paramedic, we found that there's such a huge gap between patients and caregivers and physicians. And when these programs started popping up, it really weighed heavily on my heart. And I said, especially in a rural area where you have limited physicians, what better way than to push paramedics out and really get engaged in people. A lot of these people in my community go to church with me. Our kids grew up together. A lot of these patients were my former educators and teachers, and so it really is more than just a patient. It's a deeper rapport with me. So
Well, thank you so much. And uh, similar to what I've said before, I have at least 5 or 6 other questions to ask you, but I'm going to hold back and just for the sake of time and bring on Acts 2 project coordinator Tamika Norton Brown. Hi, Tamika.
Hi, Dr. Jean. Good evening, everyone. What I am going to do is to give information regarding our Acts 2 program, and then we'll also take a tour of our website. Next slide, please. Okay. Acts 2 provides 3 major types of services. The first is things like what we're doing tonight, dementia awareness presentations and workshops at faith, community, and elder care venues, as well as through social and print media across Florida and the U.S. We also provide brief telephone-based problem-solving and referral consultations to dementia caregivers and other stakeholders across Florida and the U.S., and then faith-integrated skills training and support to distressed African American caregivers of older adults with dementia across Florida. And you'll hear me give more information on what we refer to as our 12-session program. Next slide, please. Before I describe the 12-session program, let me also mention that Acts 2 is free. So all of the services that we provide, from the info and referral to the workshops or presentations, the 12-session program, every single thing that we do provide is free. You will also hear us mention that we are faith-based. That just means we have woven elements such as faith sharing, prayer, scripture into the actual 12-session program, but we're also ecumenical. So if a person does not profess a faith or are questioning, it will not prevent them from receiving help from us. The only other thing I will state is that our 12-session program, which I'm about to describe in more detail, is for African American caregivers residing in the state of Florida. But for all others, we do offer the information and referral services and the problem solving consultations. That's available to any person, regardless of race, regardless of location in the US. So our Acts 2 12-session program, it includes 7 group skills building, so 3 caregivers in a group and 5 individual sessions. All sessions are delivered weekly over toll-free telephone by trained lay pastoral care facilitators. You will hear us talk about lay pastoral care facilitators. Those are lay persons from the faith community who have either nominated themselves to be able to receive the training to lead our groups, or their adjudicatory leader has nominated them and we train them to lead the groups. In those individual sessions, so those 5 individual sessions, with that facilitator, we'll focus on goal setting and problem solving to address concerns identified by the caregivers. Caregivers typically come into our program with 2 or 3 things that they want to work on, whether that be caregiving related goals or personal goals. And they actually get 5 weeks of one-on-one time with their facilitator to work on strategies to help achieve those goals. Next slide, please. The contents of our skills building modules. We have 6 major components. The first is what we refer to as Dementia 101, which is an overview of the basic characteristics of dementia. We have relaxation training that's combined with calming prayer and or meditation. So just teaching our caregivers how to relax. There's a myth that relaxing is just you get in your favorite chair, you kick off your shoes, and all of a sudden you're relaxed. When in actuality, there is an entire process of having mind, body, and spirit enter into the state of relaxation, and we teach our caregivers how to relax. We have effective thinking about the challenges of caregiving coupled with scripture. So just being able to change the way that they're thinking about their caregiving situation. Next slide, please. We also have my favorite module. I call it the me time module. Being able to build in pleasant daily activities as a guard against emotional distress. So just being able to navigate 15 minutes to be able to take a walk or listen to your favorite type of music. We also have communicating effectively, not only with the care partner with dementia, but with family and health professionals, and then developing those effective problem solving skills through that personal goal setting. Next slide. Here are some dementia care resources that are available. There is the Florida Department of Elder Affairs, the Elder Helpline, Elder Care Locator, the Alzheimer's Disease Education and Referral Center, the Alzheimer's Association, the Alzheimer's Foundation of America. Next slide. Okay, and I often refer to this as the most important slide in the deck. For interested caregivers or stakeholders, there are multiple ways to contact us. You can reach us toll free at 1-866-778-2724, or my local to Tallahassee cell phone number, 850-274-4945. And if you call our toll-free number, that will also route to my cell phone number. So for you out-of-towners, feel free to take advantage of that toll-free number. It will still come to me. My email address is tnnorton@fsu.edu. You can also contact us here on our Facebook page, Acts 2 Caregiver Project. Leave a message, leave a comment, and we will respond. What we're now going to do is take you to our website, www.acts2project.org, and give you a little bit of information and a tour on what's available on our website. So if you would pull up the website, please. Okay. All righty. If you would if you go up to the top and click on About Us. Okay. All righty. On this page, you will find information regarding our Acts 2 program, about what we offer, the services we provide. And for those of you who have been here with us before, you will notice that we are now displaying our new and improved, more user-friendly, and I call it zhuzhed up website. So please make sure to go and take a look at our new page. If you would go back up and click on links, please. Okay. Here on our links page, you will find useful links to resources that are available not only in the state of Florida, but also nationally as well. Okay. If you would go back to the home page, or you can do it from here, click on Caregiver Resources. Under our caregiver resources, we have included things like prayers and readings, information on the basics of dementia, information on caregiver well-being and managing sleep problems. So we have a wealth of information that is available here on our page. Okay. If you would go to donate, please. Acts 2 is primarily funded by grants and private donors. So if you would like to learn more information about how we are funded and or potentially make a donation of your own, you can check us out here on the donate page. Okay. And lastly, if you would go to sign up, and excuse us, you all, this is the new page. It may be on the bottom. So this is our first time rolling the new page out to everyone. Contact on the very top, contact. Okay. Multiple ways to contact us. Here is our sign up page. What you can do if you have a question or if you just like more information, please go to our sign up page or contact page, enter in your information, and that will route directly to me through my email as well. And as I said before, we have worked really, really hard to make sure that we have a new and improved and dynamic website. So please take some time, go check it out. Send us your questions, any comments, and we greatly appreciate it. What we are now going to do is we're going to have a panel discussion where we can address any additional questions that you all may have. So if you would bring everyone back up, please.
All right, we got we have the crew, the dynamic, I would say the dynamic five. That's for sure. Have questions, multiple questions, and but before I give you these questions, I want to thank the audience for hanging in there with us. We've gone a little bit longer, but the topic merits probably a 3-hour workshop. It is so important. It's not only important, it is a neglected topic in dementia education and dementia care. So we are so blessed to have this group of people here to bring this information to the table. And now we have a question from Dr. Nick Lampy. What is the protocol for persons with dementia who wander when they're driving? It could be either Officer TiBria or Fire Chief Charlie Brunner. Either of you, I would think, would be the logical suspects for this question.
So the protocols for a dementia patient who has wandered off by vehicle, typically what we'll do is we will activate either a silver alert or a purple alert. So basically that silver alert, purple alert will display the vehicle tag number on those big billboards when you get on like I-10 or something. We also have a means to do a location services for license plates around the city of Tallahassee. And what we do is we'll also send out bolos to other surrounding agencies, counties, to say, hey, be on the lookout for this person. Be on the lookout for this vehicle that they may be in. And typically the silver alert is usually what works the best, the silver and purple alert. We also have means of, if they have a phone with them while they're driving, we can do court orders to find their get real-time location services from those cell phones, which works out way better than probably anything. That's if they have a cell phone with them.
Thank you so much, Detective TiBria. Any other comments, Fire Chief Brunner?
Yes, following up from Detective Howard, and our rural areas were connected in our 911 center. So when information's pushed out from law enforcement on especially missing persons like dementia patients, they typically involve our EMS system pretty early on to notify us. And so we get, through our computer-aided dispatch center, we get sent the sensitive information because our crews are out on the streets too. And so that way our eyes and ears and feet are on the ground as well, especially in a rural area where you have limited law enforcement.
Thank you so much. And now we have a question from Valerie McCrae. Should you notify your local police department that you have a person with dementia when they're before something has happened, in other words, if I'm getting this right, please forgive me, Ms. McCrae, if I'm misunderstand, but I think that Ms. McCrae is suggesting should persons with dementia be proactive and contact their local police department if they do have a loved one with dementia in the home, or if they're in another home, maybe even their own home.
Yes, absolutely. The more information, the better. Even if you just want to provide us with their a recent photo, we won't say, hey, we don't need it. As for us here in Tallahassee, I know if you call us and say, hey, I do have a dementia patient, is there a way that I can get a scent kit? We will offer you we will provide you with a scent kit free of charge.
Thanks so much. Any other questions that you want to bring to us, SB, our social media coordinator behind the scenes?
Can I say something about the last one?
Of course you can.
I think as we are approaching hurricane season, there might be an opportunity to register your family, register your loved one with special needs shelters, and just to make sure that those professionals have an account of folks that might be homebound or might need more attention in the event of a required evacuation. So let's just be thinking about hurricane preparedness too with this stuff.
What a great suggestion, Nicolette Castagna. Thank you. Any other comments? Charlie?
Dr. G, adding to them, it's very important that to notify your local law enforcement agency or 911 center with the new technology that we have with law enforcement and EMS and fire. Our computer-aided dispatch center can preemptively load address alerts to where these caregivers and patients are living. So when immediately an address is entered, it can pre-save information about there could be a dementia patient living here and give as many details as possible. Our computer-aided dispatch center system that we launched, our dispatchers are able to add pictures like Officer Howard said. And so even when somebody calls 911 and gives that address and that name of that patient, that picture can automatically flash on their screen, and they can get it out to the officers way before they even make contact with the family, and they can send it to our ambulances. So absolutely, please contact the non-emergency number of your 911 center and law enforcement and provide as much information as possible.
Thank you so much. Go ahead, SB, please bring it aboard. The next question. Here it is. What advice can be given to caregivers? I think it's a great question. We could get this from anyone in the group. What advice can be given to caregivers to help alleviate their fear of contacting law enforcement for help with their loved ones? I'm sure that's not a showstopper for any of you. Go ahead. Anyone can answer the question.
I think knowing that law enforcement, along with other EMS and fire, we're all on the same page. We're here to help. And knowing that we have so many resources that we can connect them to, we're not here just to put them in the back of a patrol car or throw them in the back of an ambulance and remove them from their home. We want to provide the patient and the caregiver the most comfort experience and the best customer service possible. All of our agencies are customer service based and focused, and knowing that we have teams and teams of employees and volunteers that we can activate immediately to get in there and help.
Other comments from the team, so to speak?
Another thing that you can do to alleviate the fear of calling law enforcement is typically with your law enforcement agencies, officers are assigned certain areas within their community. If you see an officer, that you see in that area, get out and speak with them. And prior to them wandering off, get them to meet your loved one so they can sit down and build that rapport. So if that officer has to come out or if that officer hears that address over the radio, they can say, oh, I know that person. Let me go out there and respond. I can probably help out more than the other officer because I know them better than they do. I have a rapport with them. Get them to learn their spots that they like to go to. If this person likes to go to your local coffee shop, and that is what the officer will, learn during the rapport building. Is community policing at its finest.
Thank you so much. I have a question for Nicolette Castagna. It was brought up in the video and also during the workshop today. What is the Safe Return program?
Yeah. So those safe return programs are Detective Howard gave an example of two of them, the Scent Evidence or the Project Lifesaver. So these formal groups that partner with law enforcement agencies, emergency first responder agencies to work with families so that someone can be recovered quicker in the event of being lost.
Thank you. And any other comments from the panel? Okay. I have other questions. I know we're going longer, but I think it's worth it. This is so needed, and we really have experts at the table to inform us. Okay. Could you discuss, Fire Chief Brunner and Detective Howard, the variation in EMS costs for emergency services across urban and rural areas? Folks sometimes are concerned about the high cost of EMS services, but then you were talking, Fire Chief Brunner, about a program that was offered, at least the community part of it, free of charge. So can you explain to the audience a little bit more about how costs are determined and how they may vary across different parts of Florida?
Absolutely. And EMS, historically, we typically charge a pickup charge plus mileage for patients that are transported from the scene or from their home to a healthcare facility. Additionally, patients that could be transported from a hospital back home or back to a skilled nursing facility get a base pickup charge plus mileage. Interesting enough, in Florida, there is no cap. So a lot of these different EMS agencies in different cities and counties have the ability to have their rates set by their city councils or board of county commissioners. A lot of these trips are insurance eligible, and the patient may be responsible for their co-insurance or their deductible. Community paramedicine, in EMS, we've always said if we don't transport, we don't charge. And so community paramedicine allows, some type of care through pilot projects and grants to come into the home. And that does reduce the cost. A lot of the fear with dementia patients and their caregivers is they're living on fixed incomes, whether it's a rural or urban area. But many times in urban areas, we see prices higher for ambulance transports. And the reimbursement rate is a little bit lower because they're not in rural areas from insurance providers. Community paramedicine is allowing these paramedics to go in and where they're funded by the state or federal grant programs like this program, they're able to not charge at all, or in some cases, ad valorem taxes and other taxes that the caregiver and their family pay to their towns and councils already cover the cost of these services.
Okay, I have one more question for the group, and this may not be something that all of you can answer, but then again, it may be. Can you share a memorable experience you've had in resolving an emergency situation with a person with dementia and their family members? A personal experience that you've had.
So I have probably a lot of working with special victims. So the most recent one I had was it was extremely unique. The patient, he was here from New York, visiting friends, high school friends. He's older male. I want to say he's 70, 80 years old. He has dementia, and he's actually a marathon runner. He had just finished completing the Boston Marathon. So his wife, she purchased a little cheap tracker, but that day he didn't have one. Him coming down here, not knowing Tallahassee at all, he left out his friend's house, forgetting, and took off running because he's a marathon runner. We probably found him on the opposite side of town. He had ran literally probably 5 to 8 miles on the opposite side of town. As soon as we got our scent evidence canine on scene, an officer located the gentleman because we sent out a picture. We sent out a bolo. It was, everybody knew about it, so everybody was keeping their eyes open, and you could tell he had no idea where he was at. He was sweet. He was okay with it, and he just said he wanted to go for a run. But it comes in that personal experience where everybody wants to, get him home safe and sound. His wife was worried about him. She was saying they had to get on a flight the next morning, but she didn't know if that was going to happen. She was very grateful for everything that we did. And I even told her, I was like, hey, listen, you're going back to New York. I don't know if they have the scent evident canines there, but I'm just going to give you a scent evidence kit just for the road. And she was very appreciative for it. We talked about a lot of the resources she can use, but it's one of those things when we have to get involved, we're all in and we're hitting the road. We want to make sure we get them reunited with their loved ones.
Annie, I think we have time for maybe one more before a final thought from each of you. Any other experiences that anyone would like to share? A memorable one in resolving an emergency situation that involved a person with dementia.
I think for me, being on the ambulance for several years as a paramedic before coming into administration, we had a patient in my hometown that was very well known, and they did not want people in the community to know that patient had the disease, and so it took a little bit of extra time in our job, interacting with the family to de-escalate the situation and kind of crisis, because the patient was hallucinating at the scene and was very agitated. So I actually used personal connections through my family and tried to talk the patient down, and we established a rapport. And I think the family was embarrassed because this was the first time anyone outside of their family knew that the patient had dementia. But I think it was comforting for them to know local paramedics coming in to help local people. And just like local officers, like Officer Howard said, establishing that rapport through community policing and stuff like that. I think that it's very important. And the family was just so overwhelmingly thankful when we actually got the patient transported. It took twice as long as a normal call would take, but the end result is the patient was very calm during that transport. We got the patient to the hospital, and they had some, it turns out the patient had some medication mix-ups that increased that agitation. And but just being able to be there and see the stress on the caregiver and the stress on the rest of the family that showed up, but being able to feel like that you were able to help and de-escalate and get the patient to definitive care, that to me makes what we do all worth it.
Thanks so much, Charlie. That was moving, and TiBria too. Very, very thoughtful and memorable experiences. I know we're going long, but I can't resist this. Forgive me. A question for Nicolette Castagna. Could you tell us, Nicolette, how you decided to move into the area of first responders and crisis management in dementia care?
Sure. So we have a partnership with the Florida Department of Elder Affairs, and there are groups around the state that are focused on community changes that could make where we live, where we interact, more inclusive, more friendly towards people living with dementia, more have even in hospitality settings or restaurant settings, healthcare settings, emergency management settings, that more folks across the board in our communities are aware of this condition so that we can be supportive of persons with dementia and they can still, despite their condition, participate in their community. Their loved ones feel comfortable bringing them around. People understand what's going on with them. They know how to interact with them, how to accommodate their different needs, their different symptoms that they have. So with that, it just kind of fell into place that there was a need for more training, better demonstration of some of the communication approaches. We wanted to put things up on YouTube so they'd be really accessible to people to watch for 5 minutes and learn something new. Things that not just first responders can learn, but family members can learn so that we can have more collaboration and healthy partnerships between all these different people that are really just trying to help persons with dementia stay safe.
That's such an important effort, and I just wanted to tell the audience and that how effective, caring, and creative you've been in bringing this important subject of first responders and caring for families through your documentary and other efforts. You have really made a sea change in our understanding of crisis management and prevention. So just thank you so much, Nicolette, for your work.
Thank you for the platform to share it. And I hope all who watch this can share it with those they love and just help to spread the message so we can all be more informed and educated and empowered in the event of hard situations arise.
And now we just a brief, and we have an affirmation from Valerie McCrae. Thank you, dear Valerie. Thank you for the group. A final thought from each of you, just a brief final thought, and we'll close it out for this evening. Want to start out? How about you, Officer TiBria?
Well, one, thank you for allowing me to be here tonight, and help out, like you said, with bringing our loved ones home if they ever do wander off. I'm happy that this is a program that we can get out to the public and the community. I've realized over the years that loving and caring for a loved one with dementia is extremely hard, and in order to do so, you do need a team. So it is good to see that this project is here and it is thriving and it is going out to the public to help everybody.
Thank you. Fire Chief Brunner.
Thank you so much for having me, Dr. G, and being a part of this panel of this wonderful presenters. I think that from EMS aspect, we have a long way to go. We have a huge need. And this Acts 2 has opened my eyes on not only caring for the patient, but we need to care for the caregivers. And, EMS has a place at the table here to be able to step up to the plate and start training people in our own communities. I think that this is a major calling for us to expand our scope and to be more involved in our community because there is such a huge need to help the caregivers, help the patients.
I'll say an amen to that. Nicolette Castagna.
I think I kind of already just shared what I'm hoping that you'll take from this, all the strategies that we shared, learning about these resources that are out there that can help you. Education is empowering. So thank you for watching. You're already on the right track by being here and learning how to respond, how to prevent hard things. And just thank you for giving me us the platform, all of us. And thank you for what you do in caring for your loved one, or if you're a professional watching this, thank you for your service. Thanks to everyone.
And Tamika Norton-Brown.
The one thing I would say, just to kind of wrap up with all of the other presenters have said, build your team, take advantage of the resources, and don't be ashamed to ask what might seem to be a silly question to you, but it could be a question that could save your loved one. So don't be afraid to take advantage of the resources. I know that in talking with all of the people that are here, there's no judgment. So don't worry about any stigma that might be attached. Reach out, ask questions. If you don't know where to start, use that toll-free number. Use my cell phone number. Give me a call and I can connect you with any of these folks that you need to be connected to. You do the best you can with the information that you have at the time. So hopefully we've given some additional information that can help you do just a little bit better.
Thank you. And what is that toll-free number, Tamika?
It is 1-866-778-2724.
Thank you so much. Well, here's my final thought, and it's a request. Please, folks, follow us on Acts 2, on Acts 2's Caregiver Project Facebook website. Our next workshop will focus on innovations in developing personally, individually tailored, meaningful daily activities for loved ones with dementia in the home setting. We'll soon be announcing the date for this workshop in the Acts 2 Caregiver Project Facebook website and our Acts 2 Project public website. So thank you so much, folks. Thank you, panel. It has been a moving experience this evening. I've learned personally quite a bit about crisis management and, equally important, community-based prevention. So thank you so much, Chief Brunner, Detective TiBria Howard, Nicolette Castagna, and Tamika Norton-Brown for your contributions this evening. Have a very blessed evening, folks.